Hello everyone, welcome to my channel, and today's video to be specific. So before we proceed, please like, share and subscribe to my YouTube channel. You can also press the notification button so that whenever I post a video you can be notified and you can watch at your convenience, because my main objective is to share knowledge and enlighten people about various aspects of palliative care, pain, and long-term illnesses. So today I am going to talk about wounds. And to start with, I'll describe what a wound is. A wound is generally the breakage, the integrity of the skin, and this can be due to different reasons. Like for instance, a wound can be caused by trauma. A wound can also be caused by a disease process. And it can also be caused by non-ambulation or prolonged stay in bed. For example, in patients who cannot walk or who cannot utilize their limbs. I understand that a wound is a broad topic, and I will be covering it bits by bits. So today I will start by covering malignant fungating wounds, and I will start by explaining what malignant fungating wounds. These are basically wounds that are as a result of infiltration of a cancer or a malignant deposit in the tissues, blood, lymph or lymphatic system, or the skin. So these wounds, they present in a manner that is very distinct from other wounds, and I will try to expound on the characteristics of these wounds. The first characteristic is that these wounds have a cauliflower appearance or shape. They also tend to be very painful, and they have also other varying symptoms, other varying signs. They can have exudation. An exudation, I mean a wound that is producing a lot of discharge. They can also bleed, and to some point they may be foul smelling. And foul smelling, I mean a bad smell that comes from a wound. The last characteristic is that the most common site of this wound is the breast. So they are very common in patients with breast cancers, but also they can affect other parts of the body. So our main aim when we encounter a patient or when a relative or a person who is of concern to us has gotten a malignant fungating wound, our main aim is to manage that wound. And before we start managing, we need to put clear what are the objectives of managing these wounds, because we must manage the wounds objectively. And the first objective is to maintain maximum cosmetic acceptability of that patient. And maximum cosmetic acceptability, I mean the patient should be comfortable, and there should be no The patient should be comfortable and she should feel she well suits in the society or in the people they are living with. We also need to maintain maximum wound humidity. And why are we maintaining this maximum wound humidity? This is to ensure that we minimize the pain in that wound. Humidity will help minimize the pain of the wound. The other reason is to manage the various symptomatology that the wound has presented with, whether exudation, whether bleeding, whether smell. We need to manage all those aspects and ultimately ensure that the patient is comfortable and can do his or her daily living activities without interference or without stigmatization. So we also, while managing these wounds, we need to do various assessments on the wounds. And these various assessments varies. To start with, we need to understand or to get a clear picture of what kind of tissues have been affected by that wound. We also need to know the tissue, the specific location the wound is, and the size, because that is very important. We also need to measure and assess the level of the pain that is coming from the wound. And finally, we need to assess the wound beds. The wound beds simply is the edges of the wound, because we need those that will help us know whether the wound is expanding or not. So, as I had stated earlier, malignant fungating wounds have different symptomatologies, and the management of this wound is based on those symptoms. Pain will be managed on its own. Smell will be managed in a different way. Exudation will be managed. Exudation, I said earlier that this also means the discharge that is coming from the wound will be managed differently. And also the smell will be managed differently. So to start with, I'll start with the pain. And I want to elaborate why these wounds are painful. This is because they tend to affect even the very deep tissues, and thus alters even the nervous surprise of the regions those wounds are. And there are basic principles of pain management. We need to understand that for us to effectively manage pain, we need first to assess that pain. We need to know the quality of the pain, the site of that pain. Is the pain radiating to other regions, or is it just on that area the wound is? And also we need to know the timing. Is the pain present in the patient every time, or it's a come and go pain? After we have assessed the pain, we need to measure that pain, because for us to achieve maximum analgesia or maximum pain control, and also be able to prescribe and administer the various pain medications effectively, we need to have measured the pain. And we are measuring the pain to quantify what amount of pain that patient is experiencing. And this measuring of the pain will help us get a clear picture of what the patient is going through. After we have measured the pain, there are various drugs that our patients can get, and these drugs range from the simple non-steroidal anti-inflammatory drugs to strong opioids. And what will predetermine the type of drug a patient will take is the level of his or her pain, and more so the response of that pain to the medication that is being administered. We also need to ensure that we are utilizing the non-pharmacological pain management methods. Not all times we manage pain using the pharmacological, and pharmacological I mean by use of drugs. We can use also other effective non-pharmacological measures, like for instance distraction. And how does this work? Distraction mainly alters the patient concentration on the site that is having pain, leading to an end result of that patient sort of assuming the pain and having peace. The other non-pharmacological measure of managing malignant fungating wound is the use of non-adherent wound dressing. Remember, these wounds will need to be dressed periodically, and in that dressing, while removing the dressing, you can traumatize the wound if at all you have used just the normal dressing materials. So in this case, silicone dressing is the most utilized dressing material for malignant and fungating wound, as it does not adhere to the wound. And this non-adherence will help prevent trauma to the patient while doing the wound dressing. The other non-pharmacological pain management method is ensuring that we maintain the maximum wound humidity. This helps to prevent much pain in the wound. We can go to the next the next symptomatology of malignant fungating wound, which are exudates or discharge. We tend to find that these wounds produce quite excessive amount of discharge, other than other wounds that we are used to, which just produce pus, and this pus is not usually in so much quantity. But for the malignant wounds, the discharge is quite much and need to be managed well to achieve the ultimate goal. And what causes these exudates? These discharges, they are mainly caused by the microbial activities in those wounds. And so the best means of managing them is to isolate the microorganisms that are causing the discharge. And once we are able to isolate the microorganisms, we are able to administer or to get effective antimicrobial therapy for that patient. Mostly, the most common used antimicrobial drug for dressing is metronidazole, but that doesn't mean that all wounds will need metronidazole. Metronidazole is used mainly because it's a broad spectrum antimicrobial drug, and depending on the organism you have isolated, we need to get an effective drug. Remember also, not all exudates are as a result of bacteria. Some as a result of viruses, others as a result of fungi. The other way to manage the exudates is using a dressing that is well absorbent. Remember, as I had stated earlier, that you tend to find that these exudates sometimes come out in large amounts to an extent which they overwhelm the dressing that is being used in that patient. So it's good to do the proper assessment and figure out what kind of absorbent material will you require for that patient. The other symptom is bleeding. Most of these cancer wounds tend to bleed, and the bleeding can range from mild to severe depending on the site and the size of the wound. So basically, what causes bleeding in malignant wounds is the presence of fragile tumor capillaries in the wound beds that tend to bleed oftenly. The other reason is because you tend to find that most of these cancer patients, they have depressed platelet function. Platelets, our blood has different components, and platelets is one of them. Platelets helps in prevention of bleeding, excessive bleeding, and the body has a normal physiological response to bleeding in our body. So whenever the platelet function of a patient are deprived, that patient is at risk of bleeding, and you should be very keen while managing such a patient. So there are various ways you can use to control the bleeding. The first way is using compression dressings, and pressure have proved to have some homeostatic effect on a wound and preventing bleeding. The other way of preventing this bleeding is nowadays we have dressing materials that have anti-bleeding properties. For example, aginates that has proved to be very effective in control of the bleeding. We also need to understand that some of these tumors occur in regions that have major blood vessels. And what happens is that with time, the erosion activities of these tumors might end up reaching those blood vessels. So in case we suspect or we anticipate that the tumor might erode a major blood vessel, we need to do anticipatory preparation for that. And massive bleeding is mainly controlled by using methods that will help the patient be calm during that episode, and also the family. So here we use dark towels. We need to prepare dark towels, and these dark towels will be used to cover the bleeding sites, because when a patient realizes he or she is bleeding too much, they might end up panicking. You see, they might end up panicking and being worried about their situation. But when we use dark towels to cover that bleeding, dark towels will not portray, will not present the situation as very much severe, because they will absorb the blood, and they will also not present the red color of the blood. They will camouflage the blood color. We also need to prepare anxiolytic drugs like diazepam or midazolam, which we will use to relax this patient during these episodes. And finally, we need to have a multidisciplinary team on board to provide reassurance to the patient and relatives. So the last symptom of malignant fungating wounds is malodor. And malodor here I specifically mean as the bad smell that comes, or the foul smell that is produced by a wound, the rotting like smell. I know different people have different definition for it, but I think the rotting smell is the simplest definition of that. And we tend to find that these wounds, they produce quite bad smells that may be disturbing to both the patient and the relatives. And so we need to manage this smell. And management of this smell is aimed at enhancing the quality of life of that patient. And we need to remember that in palliative care, our main objective is to enhance the quality of life. We want the patient and the family, or those around him or her, to be as comfortable as possible. And so this foul smell can be simply managed by dressing the wound timely. We should not wait for the dressing to soak. We should not wait for the exudates or the discharges to soak the patient's clothes, but we should do the dressing timely. So These exudates can be simply managed by use of room fresheners. Most of these cancer patients are mostly bedridden, and you tend to find families isolate these patients. Maybe they allocate the patients some bedroom where the patient will stay alone, and perhaps nobody will be willing to enter that room because they say the room is so much smelly or such. So we can use the different types of air fresheners that we have. There are a wide range of air fresheners in our markets, in our supermarket outlets, that can be used in preventing bad breath from patients who have malignant fungating wounds. But we need to remember that a disease affects people in different ways. Some people will be affected economically. Not all families can afford air fresheners. And in this case, if at all the family has some financial constraints pertaining purchasing of air fresheners, they can simply use charcoal. Charcoal has demonstrated to be very effective in absorbing bad breath. And what is done is you can get a container and put some charcoal in it, and then wet that charcoal, and then finally place the wet charcoal in a container in the room where that patient is. Within days, the smell will be over, and now the only task will be changing the charcoal time after time. So with having managed those symptomatologies, we can now go to the other aspects, because the symptoms have dwelt so much on the physical management. We need also to understand that this patient with malignant fungating wounds, a lot is going in their mind, and we have several domains that we use in managing patients, and they range from the psychological, the social, and spiritual aspect of that patient. I will start by the psychological domain. Here you tend to find that when a patient has gotten a cancer wound, a lot will go in his or her mind, and as a result, this patient will be stressed up, because a disease affects a patient in various ways, just as I've said. And to start with, independence is the most affected aspect of a patient by a disease. So this patient will develop stress from the fact that he might see him or herself as a burden to the family or the relatives. The patient might not be able to engage in his or her daily activities of living. And this stress aggravates to depression. So, while managing patients with malignant fungating wounds, it's very advisable that we do the psychological assessment oftenly, so that we can get a clear insight or a clear picture of what is going in that patient's mind. And we also need to understand that in palliative care, this is a multidisciplinary approach speciality. We manage patients with various multidisciplinaries. We involve psychologists, we involve physiotherapists, we involve physicians, and no other multidisciplinaries. So, a patient whose stress has aggravated to depression might need some psychological review, and in this case you need to involve a psychologist in management of that patient, because as we all know, depression has detrimental effects that can even aggravate to suicidal tendencies. So we need to manage these patients, and we need to involve the multidisciplinary team. The other aspect is the social domain. Remember, a patient with a big wound will not be able to interact with people normally because of perhaps the stigma that he or she may get from people or from the society or even the family. So it is good to first ensure that these wounds are well dressed, and the type of dressing we should use should maintain a low profile under the patient clothing. We don't want to dress a patient with materials that are too bulky and that will be very visible to everyone, because that will cause stigma to that patient. Remember, some people have low self-esteem. We also need to talk to the patient, take him or her through the disease trajectory to help him understand that what is happening is part of the disease process. The last domain is the spiritual domain. And I will start by elaborating what spirituality is with simple words. Spirituality is basically what we attribute to what has happened to us. And to simply show this, I would use a basic example. Like, for instance, one might trip and fall, and after tripping and falling and sustaining a fracture, that individual will have a lot of thoughts going in his or her mind about what has caused him or her to trip and fall. Is it because of something she did to someone? Is it because of something he or she has not fulfilled? Etc. So, in this patient with malignant fungating wounds, we need first to listen to them to get a clear insight of what the patient think has caused the wound to him or her. Some even might think that the wound is due to witchcraft, of which automatically it is not. So we need to provide knowledge to this patient and let him or her understand what has caused the wound. We need to make the patient understand that that is part of the disease trajectory. It is expected in that specific disease. This will help a patient towards gaining self-acceptance and overall psychological peace. At times, spiritual issues might be intractable, and in that case, as I had said earlier, we need to involve a multidisciplinary team on board. We tend to find that most of our hospitals have chaplains, others, preachers come to talk to patients. We can involve the chaplain or the preachers to talk to the patients, as they will be of great help. So that has made an end to my presentation, and my parting shot is, let us manage these malignant fungating wounds well for the beneficence of the patient and the family. And let us not only manage the physical aspect of the wounds, let us also incorporate the other domains, the psychological, the social, and the spiritual domains. Thank you so much. For more of such videos, please like, share, watch, and subscribe to my YouTube channel, and also press the notification button. Thank you.